Okay.
All right. If you have read and understood, considering it surgical anatomy station, please tell me what are you looking at in both images?
Yes.
Which
This
vertebrae?
is
Yes.
lumbar vertebra.
Both?
The the right is lumbar, the left is thoracic.
Okay, how many thoracic vertebrae are there?
Thoracic is 12.
12. Okay, and what about the lumbar?
Lumbar 5.
How many vertebrae there are in total in a human being?
In cervical there is 7, in thoracic 12, in lumbar 5, in sacrum 5, uh, uh, and coccygeal 3 fused coccygeal vertebra.
Okay,
And sacrum is 5 also is fused together.
fused together. Okay. Please tell me, right. If you could tell me the parts of the vertebrae, what is this?
This
Identify,
is a
please.
vertebral body.
Vertebral body. What is this?
This is inferior facet joint, and this is the pedicle.
Pedicle. Okay. What is this, please?
This is the inferior facet joint.
Are you sure? This is
Uh, this is part of facet mom, I
sinus
think.
process, I think. That.
Could be. Yes.
Yes. All right. What is this, please?
This is superior facet joint, superior
Yes, that's the
articulating.
facet. Yes. All right. Please tell me what passes through here.
The spinal cord.
Only
And it's the it's
layers and many other
okay.
things.
Okay,
Everything.
it's passing spinal cord, including its coverage, dura mater, dura arachnoid mater, and the pia mater. Also, it contains the internal and external venous plexus and spinal artery.
All right. Now you told me everything. Good.
Yeah.
Right. Please identify picture A, B, and C.
Uh, picture A, picture A, I think it's thoracic vertebra. Vic, and B is, I think it's the sixth,
Cervical.
the sixth cervical,
Yes.
and
C.
the C, it looks cervical.
Yes.
Maybe it is
Cervical.
the seventh also.
Yes. What is A, if you could identify, please?
It is transverse foramen,
What passes through it? What?
vertebral artery.
Yes. Good. Okay. If you could tell me what type of joint is atlantoaxial joint?
It is a synovial pivot joint.
Very good. Please tell me what are the atypical features which are present in the cervical vertebrae?
Cervical vertebrae axis have no body.
Yes.
C2 have dense process.
What's the name of
C
C2?
axis
Yes.
Atlas
Yes.
Atlas.
Yes.
And 7 have a very long spinous process.
Yes.
Yeah.
Okay, right. If you could tell me what are the ligaments which are present between C1 and C2, between axis and dens,
Apical ligament
and
and transverse ligament
yes,
and
the
apical and transverse and
anterior
uh,
and posterior atlantoaxial ligaments.
what? Anterior?
Anterior and posterior
Anterior
atlantoaxial
and
ligament.
posterior Atlantic
Okay,
axillary.
please tell me,
Hmm.
right, the differences between cervical vertebrae. Okay, right, you told me those, but okay, the differences between thoracic and lumbar vertebrae.
Thoracic vertebrae The facet joint is horizontal, while the facet joint in the lumbar is transverse. Also, the body in the thoracic is kidney shape and heart shape, but in the lumbar the body is kidney shape. Also, the lumbar vertebrae have a long, broad transverse process. Thoracic vertebrae have articulation for the ribs.
Okay.
Yeah, and this is
Right.
the
Okay, please tell me at what level vertebral prominence starts?
vertebral foramen.
Vertebral prominence starts at what level?
Prominence.
Yes,
Vertebral
prominence.
C7.
C7, very good. And at what level vertebral artery enters foramina transversum?
C6. C6.
C6, very good. Right. Okay. Right. What more I have to ask you? There is also one in C3.
Hmm.
Okay, I can't show you those because I don't have those in front of me. But they could ask you
Mhm.
that you have to show cricoid at which vertebral level, and you have to show the white bone on a living person.
The coracoid
Yes.
as at level C4.
C3.
Hyoid is C3, mom, I think.
C6. White bone is C6.
Okay.
Oh.
What I remember, the hyoid is C3, coracoid is C4, and thyroid, I think.
What is the level of termination of spinal cord?
Termination at level of L4, L4, L5.
Spinal cord between
So
L1 and L2.
L1, L2. Okay.
Okay, all right. Just suppose patient has herniation of disc between L4 and 5. Which spinal nerves will be affected?
L4 and L5, and maybe S1.
Just L5. Just L5.
L5.
Okay, where does the spinal cord ends? Now you tell me in neonate.
In neonate in L3.
L3, between L3 and L4. Okay,
L3.
right. And okay, please tell me what are the surface marking for lumbar puncture?
It is at level of the iliac crest.
Yes, very good. And then what are the layers which are pierced through the needle from skin to?
Skin, subcutaneous tissue, then interspinous ligament, then supraspinous ligament, then ligamentum flavum, then dura mater and subdural space, and then subarachnoid space.
Okay, please tell me, right, if you could tell me, right, they have also told, they've also asked what is the blood supply of the spinal cord?
Spinal cord receiving blood from anterior spinal artery,
Yes,
anterior spinal, uh,
anterior and posterior spinal arteries and
anterior and posterior
radicular
spinal,
arteries, which are branches of?
radicular artery from the aorta itself, I think.
No,
Or from the body.
yes. Okay, right. Right. Anterior, right. There are certain syndromes that you should know. What is Brown Squat syndrome?
Yeah,
And what
I
is
know.
anterior quad syndrome?
Brown Sequard syndrome is a transection or hemi-transection of the spinal cord, where there is a same side weakness and contralateral pain and temperature loss, sensory loss. While the anterior spinal cord syndrome is due to ischemia of the anterior part of the spinal cord due to aortic aneurysm repair or any intra-abdominal surgery. There is a motor loss and temperature and pain loss.
Okay. One last question. Please tell me what is in the extradural space?
What in
In
extradural?
extradural space.
Fat and vein plexus and fat and fat and vessel and venous plexus of vein.
And
This
spinal nerve roots, small artery.
spinal.
Yes, network of internal vertebral venous plexus. Other than what you have told me. Okay. Right. Okay, thank you.